morning to everyone. I hope you all are doing great. This is a new day, the day that the Lord has made. What a blessing it is to be alive. So I haven't been on in quite some time now. Sometimes things happen, and other things becomes priority. But here I am. Today I'm, just touching base and saying hi to all. So today briefly, first of all, this month March is National Kidney Health Month. So I just wanted to check in and see if you guys are aware of what your kidney number is. So you may be wondering, what is that number? Does my kidney have a number? Yes, it's a lab test that's done, and that number tells you how well your kidney is working. That's a very crucial number that you should know. If you don't know it, the next time you go to your doctor's office, ask, what is my kidney health? What is my kidney number? Okay? And that test is called the GFR. And GFR is simply an abbreviation for the glomerular filtration rate. So it's not any type of big fancy test. It's a simple blood test that's done. So the doctors will do blood tests to check your kidney labs. And your kidney labs include your bun urea nitrogen, which is called BUN, your creatinine, and that GFR. Those are important numbers that tells you how well your kidneys are working. Now, the reason why that GFR is important, because it makes you, depending on what that number is, you will have to take certain steps to either delay that progression into kidney failure. Because kidney disease, once you have kidney disease, there is no cure for kidney disease, especially if it becomes chronic kidney disease. Chronic means you've been having it for more than 3 months, so now it's at a place where it's chronic. Some things that are called acute incidents can cause kidney disease, but when it's acute kidney disease, most cases it can be resolved. Your kidney can go back to its normal function. But if you are dealing with chronic kidney disease, knowing what your GFR is very important, right? When that number starts coming down to 20 or less, you want to be taking some really important steps to prevent it from dropping down to 10 or less, to where you need to start dialysis or some form of treatment. That's why it's important to keep an eye on that number. And moreover, you don't want to wait until it gets to 20, because you may not have enough time to take those necessary steps, because it requires a whole lifestyle change. So you want to start taking those proactive steps earlier, before waiting for that number to come down to 20, because some things don't happen overnight. It takes time for your body to get adjusted to changes, even if it's little change that you make. All right, so you want your number, your GFR, to be greater than 20. If it's getting closer to 20, start taking some steps. Now you may be wondering, okay, John J, so what are steps that I need to take? Well, first and foremost, kidney disease, one of the main causes of kidney disease is diabetes. And the second main cause of kidney disease is high blood pressure. So if you are dealing with diabetes, you've been diagnosed with diabetes and high blood pressure, you want to be taking really important steps to make sure your blood pressure is well controlled, and make sure your diabetes is well controlled. And those requires taking your medication as prescribed by the doctor, making some lifestyle changes like modifying what you eat. You want to be staying away from salty foods, not eating too much salt. You want to try to exercise regularly. And even if you haven't started, any little thing counts, okay? So if you have not been doing any physical activity, you can start by maybe doing daily walks. You know, if you're able to do it every day, maybe, you know, just set aside 3 days a week. You go outside, enjoy the beautiful breeze, the nice sunny weather, and just walk for 15 minutes, 20 minutes, 30 minutes, whatever you can accommodate. Even if you can walk outside, you know, just get up and do some walk in your house, go up and down the stairs, but any amount of physical activities. So being physically active, watching your diet to stay away from salty foods, and knowing, especially we that are from African descent, we tend to cook with a lot of seasoning. The Maggi cube that we call chicken soup, it is full of salt. Sometimes we put like 5, 6 in a pot. That's like very, very salty. You may not taste the saltiness, but when it enters your body does experience that saltiness in your blood. So cutting back on the amount of salty food you eat, being physically active, keeping all your doctor's appointments, making sure your diabetes and blood pressure is well managed by taking your medicine as prescribed, and then importantly too, get in the habit of reading ingredients when you go to buy food. Look at the ingredient labels on the food and just seeing how much salt is in there, how much carbohydrates is in there, because those help you to manage getting in the habit of knowing what you are putting in your body is a crucial first step that you need to take. All right, diet modification, being physically active, keeping your doctor's appointment. You want to be drinking a lot of fluid to keep your kidneys flushed. Let me see what else. Try to get enough rest. So those are just few tips I want to share. But the main takeaway, if you don't know what your kidney number is, if you don't know what your GFR is, the next appointment that you're going to make with your doctor, be it your primary care doctor, or if you are already seeing a doctor that manages your kidney, who is called a nephrologist, the next time you go, ask them, what is my GFR? And let them tell you what it is. And based on that number, then you can start taking some necessary steps to help delay the progression of your kidney disease and to improve whatever function you already have. Thank you so much. I hope this was helpful. It's nice being back, and hopefully I will get back to you again sometime this month. Bye. You all have a wonderful day, and thank you for all your support. Bye. Be blessed.